welcome to the Alberta Council of Disability Services Accreditation webinar series. My name is Corrine Thomas. Before we start, I'd like to let you know that the notes for this presentation are available on the ACDS website. In addition, feel free to pause the video at any time should you want some independent discussion. Thank you. Hello and welcome to the introduction to Level 1 of the Creating Excellence Together or CET Accreditation Standards. My name is Corrine Thomas. I want to take the next 10 minutes or so and talk to you about the CET manual and the accreditation process. Creating Excellence Together is an accreditation process that looks at quality of service to ensure that the best quality outcomes for individuals are obtained in the services they receive. Accreditation is a quality assurance mechanism that every organization needs to go through every 3 years. There are 3 areas to the CET standards: the quality of life, the quality of service, and the organizational framework. If you have a CET manual, I would recommend that you open it up as I'm going to review the different parts of the standards and of the manual. The first section, if you notice, is an outcome statement or the title of every standard. The next section is called About the Standard, and it gives the background or the context for the standards. Following that are the indicators, and every standard has 4 to 8 indicators that speak to what needs to be in place in order to meet the standards. In total, there are 47 standards within the CET. There are additional sections to the manual that I would like to go over now. The first section is called the Appendices, and that has additional information to help you better understand the standards. There are topics such as rights, behaviors of concern, medication administration, and I encourage you to review those sections while you're reviewing the standards. The next area is called the Areas to Explore. This is a list of questions under each indicator to help staff, individuals, clients, guardians know what specifically might be asked of them when the surveyors come in and do the conversations with you. The last section of the manual is called Survey Process, and that is an outline of how to prepare for a CET survey. It starts 1 year in advance when ACDS sends you that 1-year letter and tells you all the timelines and requirements in order to prepare for CET. On the ACDS website, we have some additional resources. We have a legislation section and a resources section, and that's available to help you know and make sure that you have all the information in terms of preparing for CET, as well as information for the sector. The last section I want to talk about is also found on the ACDS website. It is called the Creating Excellence Together or CET Preparation Toolkit. It's a resource for organizations to use when helping individuals and staff prepare for CET. It breaks it down into a workbook that can be personalized for the organization. So back in 1996 is when we first looked at quality of life standards for CET. We had about 300 individuals and their support networks come together and talk about what is important for individuals in terms of ensuring the best quality of life for them. It was this information that we used to develop the Creating Excellence Together or the Quality of Life standards. Further revisions have happened, and we've had discussions with these individuals since then to ensure that the information is kept up to date. At a glance, these are the 11 standards or topics that we cover within the CET standards under the quality of life. So for example, the first one is homes. The outcome statement or the title is Individuals Have Homes. The quality of service standards are intrinsically linked to the quality of life standards. And what I mean by that is that we look at the staff and the support that they provide the individuals when we look at the quality of service standards. So as you can see, the quality of service standards are the same 11 topics that you would see in the quality of life standards. The outcome statement or the title is a little different though. So in the quality of life, we say individuals have homes. In the quality of service standards, we say that individuals are supported to have homes. When it comes to talking with the staff, we do have 2 additional standards that we speak to. The first is around behaviors of concern, and the second is around human resources. This specific information is not linked to the quality of life, but rather the organizational framework part, which I'm going to talk about in a minute. We want to see how the policies and procedures and information that is developed at the organizational or management level trickles down to the frontline staff. The third section of the CET manual is called Organizational Framework, and it focuses on the policies and procedures and strategies, protocols, all that kind of paper information that helps staff be successful in order so they can provide the support to the individuals and provide them with the best quality of life possible. Accreditation, as I mentioned, is a quality assurance mechanism that shows how well organization supports the quality of life outcomes for the individuals and supports staff in their efforts to meet that. The organizational framework section is broken into 4 sections. The first section, Honoring Rights of Individuals, focuses on the intake process, confidentiality, concern resolution, and behaviors of concern. Health and safety speaks to risk management, health and safety for individuals as well as staff, assistive technology and environmental interventions, and medication administration. Human resources speaks to employee success, employee satisfaction, and training. The last section, the structure of organization, focuses on the board governance, the overall planning, the fiscal responsibility of an organization. Standards are measured through on-site visits we call site surveys. A standard site survey can be 3 days, but as many as 5 days, depending on the size of the survey. Surveyors that come to your organization have a background in the field and are provided training through ACDS initially as well as annual refresher training. We also want to ensure that there's objectivity, and by doing so, we support surveyors to come to service providers that are outside of their region when doing a survey. In addition, we try to match the experience and expertise of the surveyor when looking at which survey they are going to do. A standard survey will have 2 surveyors, so a team leader and a team member, and will generally occur over 3 days. Larger surveys could occur with 4 surveyors over 5 days. Together, the surveyors work together to get a good understanding of the organization and how the CET standards apply to them. Information is collected in a variety of ways because each indicator asks for something just a little different. While conversation is predominantly the method we use, talking to individuals, guardians, and staff and management, we also have to review files, the policy manuals, as well as templates. In addition, we also look at observing and what observations we see while we're on site. When we look at measuring the quality of life standards, these are the conversations we have with the individuals, with the guardians, with their family, and we call that their social network. Individuals are chosen random yet representative by ACDS, and individuals have a choice of whether they want to participate or not. However, ACDS does record the reasons if individuals decline participation. While we prefer independent conversations, we do recognize that sometimes individuals are nervous or would prefer to have someone sit in on the conversation with them. And in that case, they can choose whether to have the guardian or staff sit in with them. However, we would like to have additional conversations with the staff or the guardian because there are additional indicators that we need to ask about, and sometimes that information is a little more sensitive. We also want to ensure that the individuals have conversations where they're comfortable. At the same time, we want to make sure that there is a good cross-section of the services and locations and that the surveyors are able to view and observe those as well. When we look at the quality of service standards, we are talking to staff and how they support the individuals in their success and meeting those outcomes. The focus on these conversations is the direct support, and so it's important that we talk to the key workers of the individuals that were selected to be part of the survey. So unfortunately, staff do not necessarily get the option to say yes or no of whether they'd like to participate in CET. In addition, as I mentioned before, there will be additional questions that are asked of staff in terms of behaviors of concern and human resources. The service provider management team prior to CET gets what we call a self-study guide, and they prepare that prior to the survey and submit that to ACDS, and ACDS gives that to the survey team so that they have time to review the paper part of a survey. We call that paper compliance. And that really helps the surveyors focus on what they need to when preparing for a survey and what needs to be done while we're on site. When we're on site, the management group will have time to talk to the survey team and provide additional information and answer any questions that might be outstanding. Preparing for CET is a huge undertaking, and ACDS has some additional supports available. First of all, we have what we call a pre-survey visit, and that is an opportunity for an ACDS staff such as myself to come to your organization and talk to the individuals, the guardians, the staff, management, whoever wants to be a part of it, and talk to them about CET and answer their questions, talk about how CET relates specifically to their organization, and how to prepare for some of the standards and indicators. We also provide post-survey support, and that is if an organization does not meet accreditation successfully. We work with organizations for up to 8 months to help them come into compliance. When a survey team leaves an organization at the end of a survey, they cannot give an absolute pass-fail to an organization, but they can provide additional comments and talk about a general overview of the survey and what happened while they were there. At about 6 to 8 weeks, the service provider will receive the final report, and once accreditation level 1 is achieved, a CET certificate will be sent that is signed by ACDS and the funder. Accreditation is valid for 3 years. ACDS recognizes the amount of work that goes into preparing for a CET survey, and so we encourage you to celebrate with your organization, whether that's with the staff, the individuals, the guardians. We want to provide opportunity for you to communicate with everybody about the outcome of your survey. Thank you for taking the time to walk through the Creating Excellence Together's Level 1. If you have any further questions, please feel free to email us. Thank you and good luck as you prepare for CET.